Dr. Speaker, Dr. Vice Speaker, members of the board, delegates, colleagues, guests. It is my honor to be with you this evening and to address this House for the last time as your AMA president. On inauguration night a year ago, I took the oath of office fully aware of the privilege and responsibility that comes with a high-profile position like this one. The responsibility to speak out against barriers that our patients and fellow physicians face. The responsibility to stand up for science and the high ethical standards of our profession. The responsibility to give voice to the everyday challenges that physicians are experiencing, helping lead us to a better healthcare system that is more inclusive, more sustainable, and better supports the needs of physicians so that we can take the best possible care of our patients. Now, this all sounds simple enough when I say it out loud, but work of this importance comes with incredible personal costs that I didn't fully appreciate when I began this role. Late-night meetings, extended travel itineraries, crisscrossing continents, interminable flight delays, nearly constant airport food, prepping for interviews, podcasts, radio, reporter roundtables, live TV appearances, time away from my home, my patients, my practice, measured in weeks, not hours. These kind of demands would take a toll on anyone, but when you're a husband and a father to a 5-year-old and a 17-month-old, the weight of your decisions are magnified. One night after tucking my eldest son, Ethan, into bed, I let him know that I'd be on a plane later that evening and would miss breakfast the next morning. He turned to me and asked, "Daddy, why do you have to be AMA president?" Well, every person in this room knows that a question like that from a child cuts through the heart. It wasn't the first time in our home that question had been asked. Before deciding to run for this office, my husband Judd and I had conversations where we asked ourselves, why do this now? It's a question perhaps many of you have asked yourselves over the years as you've juggled your work, home, AMA responsibilities with this difficult job of being a physician advocate, a job that seems to get more complicated and challenging with every passing year. For me, I keep coming back to the same answer. This moment in healthcare demands my attention. This is my fight. This moment in healthcare demands all of our attention. It's all of our fight. The stakes are high. The risks to patients are growing. The demands on physicians are unrelenting. The world around us is mired in uncertainty, misinformation, and mistrust. And so we summon our strength and speak out. We use our voice. We lean on one another for support and encouragement. We fight for what we know is right. A better healthcare system, a more accessible healthcare system, a more equitable healthcare system, a more financially sustainable healthcare system. I'll take one more flight if it means unburdening physicians from the administrative headaches that are driving burnout and early retirements. I'll keynote one more conference if it means tech innovators have a greater understanding of what we need so that they can design smarter digital tools that actually improve health and make our jobs easier. I'll take one more meeting on Capitol Hill if it means my husband and I and our boys and other LGBTQ+ families can get the health care we all need in a system that's free from bias, stigma, and discrimination. I do this work. Everyone in this room does this work because the future of our profession and our nation's health cannot be left to chance. This is why we fight. Now, last fall, after we gathered for the inner meeting at National Harbor, I had the opportunity to fly to Greensboro, North Carolina, to meet with the Old North State Medical Society, one of the oldest medical societies for Black physicians in the U.S. Their work began in the years after the Civil War, spanned the Reconstruction period, Jim Crow, the 1960s Civil Rights era, and continues to this day. I was invited to visit with them, meet their leaders, and deliver an address about our AMA's work to advance equity and social justice in medicine. I was honored by their invitation, but our AMA's long and well-documented history of exclusion and discrimination weighed heavily on my mind. It's why Black physicians created organizations like Old North State in the first place. For much of our history, our AMA wouldn't have received an invitation like this, and if we had, we would not have had much of consequence to say. But on that crisp fall afternoon, we had meaningful improvement to discuss, an update on our deep work to help solve long-standing health inequities, address determinants of health, create pathways for a more diverse physician workforce, ensure that medical devices and technologies work for all patients, and the steps we're taking here to right past wrongs of our AMA. This spring, I was invited to meet with leaders from HHS, the Department of Labor, and the Treasury to share AMA views about a proposed rule that will finally end a 16-year battle with insurance companies who have failed to comply with the landmark 2008 mental health parity law. More than a decade after the law was passed, patients are still 9 times more likely to have to go out of network for mental health, behavioral health, or substance use treatment than for medical or surgical services. That is not mental health parity. And despite the efforts of the last 2 administrations, the health plans have flagrantly flouted the rules with no consequence. A new rule will finally put some teeth into this law and make it much easier for patients to access the mental health care they need and for physicians to be appropriately compensated for the care they provide. On another day in New Orleans at the Uniformed Services Academy of Family Physicians, I spoke to hundreds of active duty physicians about how our AMA was fighting proposed drastic cuts to military medical personnel that could negatively impact the health of military families, readiness, and national security. Last fall, after the FDA lifted its ban on gay men donating blood, something our AMA advocated for many years, Judd and I made our first life-saving donations. On Match Day in March, I addressed the graduating students at Harvard Medical School at a time of heightened tensions over global events, challenging them to use their voice for good in service to their patients and humanity. And just yesterday, I was in the Oval Office at the White House, meeting with senior administration officials about how health systems must step up to address the growing public health crisis of gun violence, a conversation that our AMA has been steadily advancing. On these occasions and so many others throughout my presidency, I have been reminded of the importance of showing up, of taking risks, of engaging in difficult conversations, of telling our story, of sharing our vision as dictated by the policies of this House. That is the power of what we do. I show up, you show up, we show up. In all the ways that matter to our patients and our fellow physicians, our AMA shows up. I began my presidency educating others about the important ways the AMA has evolved since I first joined the organization as a medical student, how we've become a more inclusive organization, a courageous ally to many, including myself, who had faced prejudice or discrimination simply because of who they are where they were born, or what they believe in. And I'm so proud of our AMA's growth and have had a hand in helping us change for the better. We still have consequential work ahead of us, barriers to break down, inequities to erase, and shared priorities to advance. And although the pace of change can be frustratingly slow, I want to assure you tonight that we are making meaningful progress, and we are being recognized for lending our powerful voice to the cause of equity and justice. Now, diversity as a concept and people from diverse backgrounds in specific are under attack here in the US and around the world from extremist groups and movements that are surging in popularity. But extremism, oppression, and discrimination, including anti-Semitism, which I have personally been the target of, are antithetical to the values of the medical profession, and our AMA must always stand up for democracy, pluralism, equity, and human rights. This work is an essential part of who we are as physicians and what we do as an organization. We continue to follow the science and evidence, explore new ideas, move in new directions, and right our past wrongs. We lead with our ethics and our values. We advocate for patient-centered design and new technology. We're defining the guardrails for safe and effective adoption of health AI. We're developing strategies to revolutionize medical education and training, defending patient and physician autonomy, and speaking out against medical discrimination. Our nation continues to grapple with the drug overdose epidemic, but our AMA is showing up to change policies and save lives. And last year, we saw a drop in overdose deaths for the first time in 5 years, a welcome sign of progress in this long and deadly battle. Now, when one of the nation's largest health insurers, not naming any names, was suddenly hit with a cyber attack, and the process to submit healthcare claims for reimbursement was frozen, well, physicians were lost, didn't know where to turn. And once more again, our AMA showed up, creating resources for physicians desperate for information while pushing federal agencies and insurance companies to take immediate action to solve the payment debacle. This is why we fight. Now, we do more than just combat problems. We're also driving the change that we strive to create. The AMA recognized 72 hospitals and health systems through our Joy in Medicine program last year, creating an unmatched understanding of the best practices and solutions to solve the physician burnout crisis that health systems across the country can learn from and implement. Solving the burnout crisis and ensuring that medicine remains a highly desired profession, this is why we fight. Reforming our broken Medicare system that punishes physicians for being physicians, this is why we fight. Medicare reimbursement has plummeted 29% since my first year of medical school in 2001, 29%, and that's after we were able to claw back half of the planned cuts for 2024. Medicare reform is our top advocacy priority because it's crippling the sustainability of physician practices, it's threatening patient access to care, and it's choking the pipeline for future physicians. And I'm proud to stand here tonight before this House to tell you that the momentum is shifting towards significant reform, and our AMA is changing the conversation. Thanks to our AMA's comprehensive Fix Medicare Now campaign, multiple hearings, media visibility, grassroots outreach, and extremely persistent lobbying efforts, there is now broad acceptance that the current Medicare payment models do not work. And there's growing support in Congress for Medicare reforms aligned with our models that seek to put physicians on equal footing as everybody else in healthcare. But we got to keep the pressure on because the current system is unsustainable and because physicians, none of us should have to worry about how we're going to keep the lights on. Now, protecting our patients from unsafe scope of practice expansions by non-physicians, that's another reason why we fight. These bills are relentless. Optometrists seeking to perform eye surgery, naturopaths pushing for the authority to prescribe medication. Our AMA helped defeat more than 100 of these outrageous scope bills last year and dozens in 2024. We know that scope expansion directly impacts our most vulnerable patients, including my fellow veterans, which is why I testified in a congressional hearing on Veteran Affairs to discuss how these expansions threaten the quality of care that our veterans, my shipmates, and I receive. Our patients' health, this is why we fight. Eliminating physician busy work, this is why we fight. Look, we've all got horror stories to share about the overused prior authorization process that results in delay after delay until too often patients just give up. They abandon necessary testing and treatment altogether. We, as physicians and our patients, deserve better. That's why we welcomed news last year that United Healthcare and Cigna each reduced the volume of their prior authorization requirements by at least 20%. And why we celebrated a CMS final rule that makes long overdue changes to prior authorization for all of the government-regulated health plans and will reduce decision times. These changes will save physician practices and our healthcare system an estimated $15 billion over the next 10 years. Never mind the countless hours and incalculable frustration of physicians and patients. None of this would have happened without AMA advocacy. Now, lately, some of our country's largest chain stores and pharmacy retailers, they've decided to scale back or end entirely their experiments in healthcare by closing their walk-in clinics. And despite the stated goal of expanding healthcare access to patients with limited options, these corporations were unable to create a healthcare model that was financially viable. And now their closures are leaving gaps in care for thousands of patients who came to rely on them. Now think about that. These are some of the largest for-profit companies in the world, and they can't make today's primary healthcare model sustainable? If they can't make it work, how can we possibly expect physicians to? That's a challenge I'm going to continue to prioritize as I leave the presidency. How can we make the practice of medicine sustainable? How can we ensure access to care? How can we continue to recruit and support the best and brightest into medicine? This is why we fight. Our families are why we fight. Our patients are why we fight. Our colleagues and our profession are why we fight. And we're going to keep fighting until this work is done. Thank you for the honor and privilege of serving as your AMA president. It's been a hell of a year. Listen, before I step away from the podium, now that I've addressed the House, I want to take a moment to address some of the most important people in my life who are here with us tonight. My husband, Judd, my two boys, Ethan and Asher, my mother, Catherine, and my in-laws, Mel and Marianne. You know, tonight as I stand here reflecting on my journey, guys, my heart is filled with such immense gratitude and love for all of you. And our accomplishments this year are as much yours as they are mine, because I just couldn't have done any of this without your love and support. So to my beloved, To my beloved husband, Judd, my partner of nearly 13 years, your unwavering support and understanding have been the cornerstone of my success. You have been the anchor that this sailor has always needed, my confidant and my greatest cheerleader. You've managed our home with grace and ensured that our children never felt my absence any more than they had to. Your sacrifices, your strength, your love have given me the space and the courage to pursue my dreams. To my precious children over there, Ethan and Asher, I know that having Daddy away for days and sometimes weeks at a time has been hard. But your smiles, your hugs, your laughter, and your endless questions about why I have to be AMA president, those have all been my greatest source of motivation. You guys have shown more patience and resilience than a lot of grown-ups. I'm so proud of you both, and I want you to know every moment that I was away, I was thinking about you, working hard to make the world and our healthcare system a little bit better for you guys, and frankly, for all children. Now, our journey as a family hasn't always been easy. We've been physically apart more than I would have wished, and at times we've been attacked and harassed because of who we are and what we believe in. And I know the sacrifices you guys have made, the times you had to stay home because it wasn't safe to go to school, the precautions that we had to take as a family that were limiting, all those missed bedtimes and play dates, all those disappointments, they made my resolve stronger, knowing that I had a family as incredible as ours, always able to come together to get through any obstacle. So, as I return home, hopefully, Bruce, and hand over the reins of this incredible organization, I'm so excited to spend more time with you all, create new memories, and be present in all the ways that I have missed. Thank you for your patience and your love and your endless support. I couldn't have done any of this without you. Guys, if you want to come up, I've got something for you.